Hi, I'm Dr. Parsa Mohebi, and I demonstrate how to use Laxometer. Laxometer is a device to measure the laxity of the scalp or mobility of the scalp before hair transplant procedures. It has three components. One is the mobile part that has a rough surface that sits on the scalp and get a good grip of the scalp to be able to bring it up and down. The second portion is the measuring rod. That is, it has centimeters and millimeters on it, and it shows us the mobility of the mobile part on it. And the third component is a small tracing rubber ring that helps us to see the distance between the most superior to the most inferior position of the mobile part. So I'm gonna show you how to use it in patients before hair transplant procedures. So first of all, you have to hold the Laxometer in this position, bring the tracing ring all the way up, the tracing rubber ring all the way up, so it touches the ring of the mobile part. And then if patient has long hair, you want to part the hair in three different areas and put the mobile part on the scalp and push inward and get a good grip of the scalp so you can bring it up and down and move the scalp up and down. So the three positions that I usually use is the mid-occipital line position, right on the occipital notch where we're going to have our strip there or remove the strip from, and the other two sides are going to be on left and right area of the donor area, above the mastoid zone, and it's going to be 5 to 6 centimeters above the mastoid. So I'm going to measure here. This is mastoid. 5 centimeters above that, this is area that is probably going to be at the middle of my strip, and then I put the mobile part, the rough surface, right here, and I put my thumb in the place that is actually made to hold my thumb. So I push inward as my stabilizing my whole hand with patient's head. So the tracing ring is at its most superior position. I bring it all the way up, so to the position that I cannot move it any higher. And then I grab the measuring rod with the other hand and fix it with patient's shoulder or patient head. So I make sure it won't move. And then I bring the mobile part all the way down as much as I can, to the point that I cannot bring it lower. A few more times, I'll bring it all the way up and all the way down. When I bring it all the way down, that moves the tracing ring down. And tracing ring on measuring rod, it measures the mobility of the scalp, the range between the maximum superior, maximum inferior position. Okay, so I have the measurement here. In this case, is 2.6. I'm going to repeat this in three different areas. You have to remember the patient's head should be straight, should not be bent down or patient should not be looking up. Same thing, I part the hair here, put my Laxometer there, put my fingers up here, tracing ring is all the way up there, bring it all the way up. Make sure patient is not bending his head by you pushing forward, and then bring it down, all the way up and all the way down. So on the back, it is a little bit less. It's like 2.4 millimeter, 2.4 centimeter. So I do the same thing on the other side. So part it, put the Laxometer on, bring the tracing ring up, grab it, bring it all the way up, and bring it all the way down. You can add more spots on the scalp that you want to measure the laxity, or if you want to remove skin for any other reasons from other areas of the scalp or even the body, you can use a Laxometer accordingly in those areas. I'm Dr. Parsa Mohebi, and that was a video for to illustrate how Laxometer works. Thank you.